Today's video is all about metformin. I'm going to answer some of the most frequently asked questions about it, like how does it work, how do I take it, what should I do if I forget it, how long do I have to take it for, what are the side effects, how can I avoid or reduce these side effects. Hey everyone, welcome back to our Kasana Health channel. I'm Sarah. I'm a licensed pharmacist with a passion for diabetes education, and my goal has always been to help increase people's knowledge to help end type 2 diabetes while taking fewer pills. Now stop right there, because if you're thinking that it's a bit contradictory that I'm a pharmacist who wants to help you take fewer pills but also teach you how to use metformin, well, let me just say this. Not all medications are evil. A lot of times they're necessary and they can be a huge help to help improve our health. But please remember that it's not because you start taking pills today that you have to do so for the rest of your life, especially if you start implementing lifestyle changes that can help you gradually and safely get off of them. All right, now that this has been cleared up, let's begin. FAQ number 1. What is metformin prescribed for and how does it work? Metformin is mostly prescribed to treat type 2 diabetes, or in some cases it's also prescribed to prevent type 2 diabetes if you're at high risk of developing it. It's also prescribed to treat PCOS, which is polycystic ovarian syndrome, a condition that affects how women's ovaries work. Now, this video is about type 2 diabetes, but if you're interested to learn more about metformin and PCOS, let me know in the comments below, and I might make a future video about it. But for type 2 diabetes, metformin is usually prescribed when diet and exercise alone for at least 3 months are not enough to regulate your blood sugar. And it works in 3 different ways. 1, it lowers your blood sugar levels by making you less insulin resistant, which means your body responds better to insulin signals and allows more sugar to move from your blood into your cells. Number 2, metformin reduces the amount of sugar your liver releases into your blood. Because if you have type 2 diabetes, you're insulin resistant, and that means your liver is usually over-releasing sugar into your blood. So metformin will help slow that release down, which helps lower your blood sugar levels. And number 3, metformin delays the absorption of sugar from the food you're eating, which means it helps your blood sugar levels not to spike up too fast after a meal. Because of these mechanisms of action, metformin is pretty effective at lowering your blood sugar. But it's good to know that it can sometimes take up to 2 months before you notice the maximum effect on your blood sugar levels. Of course, you might notice improvement within a few days, especially if you start making changes in your eating and lifestyle habits at the same time. FAQ number 2. How do I take metformin? There are 2 types of metformin tablets. Immediate release tablets, which are taken 2 or 3 times a day, depending on your dose, and slow release tablets, which are taken just once a day. The tablets, both immediate release and slow release, come in different strength, 500, 850 milligrams, and your doctor will be the one to tell you which and how many to take every day. Remember not to compare your dose with anyone else's because everyone is different and everyone requires a different dosage. Regardless, however, of the tablets you are prescribed, you should always be taking it with meals to reduce your risk of side effects. And remember that the tablets can't be chewed, so swallow them whole with a good glass of water. FAQ number 3. What should I do if I forget to take my metformin? The answer here is pretty simple. Take your next dose at the usual time. There's no need to double your dose to make up for the forgotten dose. And you can try setting an alarm on your phone to remind you to take your meds if that's something that happens often to you. FAQ number 4. How long will I have to take metformin for? So here's the deal. Most doctors and healthcare professionals will tell you that treatment for diabetes is for life. However, I find that answer to be a little misleading because it makes it sound like all you could do is treat diabetes, and it completely ignores the fact that you could also be attempting to reverse diabetes or put it in remission. What's the difference between treating and reversing diabetes? Well, if you're trying to treat diabetes, it means that you're simply trying to reduce the symptoms and trying to reduce the progression of diabetes. And in that case, you will usually be taking metformin and other meds for life. But if you're trying to reverse diabetes, it means that you're trying to make gradual and sustainable changes to your lifestyle habits. It means that you're not just trying to manage your blood sugar levels by throwing a bunch of pharmaceuticals at it. It means that you're trying to attack diabetes more at its root cause. In which case, you might very well be able to not take metformin or other meds for the rest of your life. Of course, reversing diabetes and getting off of meds is not possible for everyone, but making lifestyle changes is essential for everyone living with type 2 diabetes. And even if you keep taking metformin for life, that's okay. It is not a sign of failure. Taking metformin doesn't mean that you haven't been successful at making healthy changes to your lifestyle habits. Plus, it can be reassuring to know that it's safe to take metformin in the long term, especially if you don't have any unpleasant side effects from it. Which brings us to the next FAQ. Number 5. What are metformin's side effects? Like all medication, metformin can cause side effects, but not everyone gets them. The most common ones are upset stomach, nausea, diarrhea, vomiting, or loss of appetite. If these side effects appear, they usually appear when you first start taking metformin, or if you ever have to increase your dose at some point. But they should disappear after a week or two as your body gets used to taking it. The good news is, unlike other meds for diabetes, metformin alone doesn't usually cause hypoglycemia, which is dangerously low blood sugar. And it doesn't cause weight gain either. In some cases, it can actually help you with weight loss. FAQ number 6. How can I avoid or reduce these side effects? The first recommendation here is to always take metformin with food or with your meals, like I mentioned before. And secondly, when you start taking metformin, you should be increasing your dose gradually to allow your body to adapt to this new medication. That's something that your doctor or your pharmacist can help you with in the beginning, so you know how and when to increase your dose. If you follow all of these recommendations and you find that your side effects don't disappear over time, then there are 2 options or solutions that could help you out. Option number 1 is to switch to slow-release tablets of metformin because these tablets usually have less side effects. I will mention, however, that the slow-release tablets are usually a bit more expensive, so that's something to keep in mind depending on where you live and what kind of insurance you have access to. Option number 2 is to reduce your dose to the maximum dose that your body specifically can tolerate, which means the dose where your body doesn't suffer from any side effects. Either way, please make sure to always discuss this with your doctor or your pharmacist before making any changes. FAQ number 7. Can I drink alcohol if I take metformin? Can I drive after taking metformin? Should I supplement with vitamin B12? Can I take metformin if I have kidney problems? Does metformin affect my contraceptive pill? Does it affect my fertility? Can I take metformin if I'm pregnant or breastfeeding? As you can see, that's a lot of unanswered questions. Hit the subscribe button if you want to hear the answers to these questions in the next video. I promise you don't want to miss it. Drop any other questions or comments below. I love it when people share their experiences and motivate each other to lead healthier lives. Thanks so much for watching, everyone. Stay healthy, stay safe. I'll see you in the next video. I said too many words, that doesn't make any sense.